Hi everyone, and welcome to another episode of Aesthetics Undressed with Dr. Zunaid. This is the first in 3 videos that we will be doing where we will be discussing the 3 particular areas of the face. So the first bit that we're going to discuss today is the upper third, or the top third from the hairline all the way down to the cheekbones and all the structural rejuvenation in between. We are doing these videos just to kind of educate patients who may have a little bit of difficulty in understanding what treatment they may require, or perhaps they have done some research and the treatment that they are seeking is possibly not the correct treatment for them. So the first thing that we'll talk about in rejuvenation of the upper third of the face is, of course, toxin or neurotoxin or neuromodulator injection. And what we find is the most common area that patients will require toxin would actually be in the crow's feet area. So that would kind of constitute one area. The muscle that goes around the eye is incredibly thin, and it usually requires between 3 to 5 injections per side to help to smooth out those crow's feet lines, and that constitutes one area. The second area is usually the glabella area, which is the area between the eyebrows. Some people call it the 11s, and these are really sort of the frown lines that you find here. What we need to do is relax 3 bits of muscle. The one muscle sits at an angle like this, up against the eyebrow on both sides, and there is a triangular muscle that sits just between the eyebrows. So these are brow depressors. So what we have to do is, when we inject toxin into them, they will then kind of relax and kind of freeze over or be treated, and then that alleviates the lines there. The third area is, of course, the frontalis muscle, which is a big muscle that extends all the way into the scalp, and that is when we have the horizontal forehead lines, and we sometimes place injections there to smooth out the forehead. So not everyone is suitable for toxin. There are some patients for whom it is contraindicated. For example, patients who are pregnant or breastfeeding, because the safety of toxin has never been established in those patients. Other patients are patients who have neurological conditions such as Lambert-Eaton syndrome or myasthenia gravis, but of course all of this will be discussed with you when you present yourself for consultation. We also find that patients who have got lines that are quite deep set may not necessarily be good candidates for toxin, because it will not help to take those lines away. It may help to soften them, but those lines will still be there, which brings us on to our next topic, which is actually dermal filler for the upper third. So where we like to place dermal filler in the upper third is the area is usually in the temples. We can place it into the forehead if there are little indentations or a little bit of atrophy of the muscles, just to get a kind of nice rounded appearance. We prefer not to place filler in this area around here, and the reason for that is we have 2 sets of arteries on either sides that carry a direct blood supply to the eye. So for that reason, it is considered an area of extremely high risk. So we prefer not to place any kind of filler within that area. What we could potentially treat that area with is perhaps a skin booster, which is a kind of a dermal filler, but it's a lot lighter, and it doesn't place a lot of pressure on the blood vessels and doesn't cause a lot of swelling within that area. So that is another treatment option that we could use for the glabella area or the 11s and the rest of the forehead. Going further on, there are some patients who may have hollowing underneath their eyes and the formation of what we call a tear trough. When a tear trough is formed, there are usually 3 different types or 3 different grades as such, and not all patients, again, will be suitable for tear trough filler. Patients who have what we call malar festooning, or kind of fat pads that have herniated underneath the eye, are poor candidates for tear trough filler. The reason for that is when the filler is injected into the tear trough, it draws a lot of moisture from the tissues, and it can actually make the fat pads underneath the eyes look worse. For those patients who come to us for consultation and advice, we're happy to refer them on to plastic surgeons or oculoplastic surgeons, people who are specialists and super specialists in the treatment of the perioral rejuvenation area. It may also involve a surgery called a blepharoplasty, an upper blepharoplasty where excess skin is cut off, or a lower blepharoplasty with or without fat repositioning. So the surgeons may take that fat and they may actually use it to build up the entire eye. Generally, patients get exceptionally good results because we send them to these specialist surgeons who do many cases like this, so they're quite proficient at it. So with tear trough filler, we find that we use specialized fillers that either contain antioxidants or glutathione, minerals, vitamins, and amino acids. And when injected, this filler will help to build up the area, but it will also help to lighten the area and improve the contour. The tear trough area is a notoriously difficult area to treat, and we find that patients sometimes have a high level of dissatisfaction if certain criteria are not met during the consultation. So for this, when tear trough treatment is being anticipated by the patients, a very detailed consultation and examination will be done by either myself or Dr. Shirin before treatment goes ahead. The third thing that we could do as a treatment modality for rejuvenation in the upper third are, we sometimes have patients who have a bit of a brow droop, and we can use PDO threads, which are inserted up here at the top at the hairline, to perhaps help and support. And with those suspension threads, what we find is it helps to lift the tail end of the eyebrow pretty much to what I'm doing now. So this has aesthetic impacts, but it also has functional impacts, where if the brow is slightly lifted and supported, what we find is that the upper eyelid actually opens, the skin looks more taut, and it gives a more fresher, radiant appearance to the upper third of the face. So you might find that you're just feeling a little bit dull and tired. You might feel that your eyes are feeling tired. You may be getting comments from friends and family and colleagues that, you know, perhaps you look a little bit tired, and that's when we need to look at some periorbital rejuvenation, and some treatment around the eyes. There's also a non-invasive treatment that patients have, which is Excellus eyes, which consists of radiofrequency applied to the periorbital area. So radiofrequency is a great treatment modality for skin tightening and skin rejuvenation. It involves placing a probe in the area around the eyes, and it heats the skin up to a certain temperature, and by that you actually get nice contraction of the SMAS layer or the muscles underneath, and that gives an overall effect to the skin that you can see. So I hope that you find this helpful. These are just some of the ways in which we can treat